So in this video, I'm discussing about the leukemia video stations. Leukemia video station description, what we find. Normally, we find that the child is ill looking, small for age, he is anemic, he is on inside the, of course, hospital setting, and we find the features of leukemia. What are the features of leukemia? Like pale we find there is lymphadenopathy, then abdomen distensions, like someone is doing the abdomen examinations, there is hepatomegaly, we find petechial rashes as thrombocytopenia is the feature. So petechial rashes which are non-blanching and child is ill looking. So in leukemia, what are the differential diagnosis we can keep? So there is rash we are seeing, lymphadenopathy we are seeing. The DD we can keep like meningitis, sepsis, DIC, ITP, hemolytic uremic syndrome, Hennesculin purpura, COVID, and NAI. The history we can ask as usual, the onset, course, and durations, anything make it better, anything make it worse. Actually, it is a gradual over period, like over a period it happens. Then night fever, the features of leukemia, we know night fever, weight loss, anorexia, pallor, palpitation, chest tightness, sign of increased intracranial pressure, abdominal distensions, abdominal pain, vomiting, swelling all over the body, and urifocial bleeding. Then family member having the same rash. And question for DD, what are the DD we keep? Hennesculin purpura, so the distribution of the rash. If go hemolytic uremic syndrome, then about the how about the color of the urine? Is there a decreased urine? And if we are going meningitis, so high grade of fever, rapid onset of fever, repeat the rashes, evolving rashes, neck stiffness, and if COVID, then contact of similar persons present on NAI, any threat of safety in home. So these are the DD we are keeping, ITP, any side of bleeding, other side, these are. So what are the examination we do? Suppose it is a case of leukemia. The examination we do first airway, breathing and circulation, ABC. Then we are going for the vitals, examine the rash with glass test that is non-blanchable, examine the private area in male because testicular affection presents. Then abdominal examination, lymph node examinations as hepatosplenomegaly and lymphadenopathy is a features of leukemia. Neurological examination, MSK examinations, cardiac and chest examination. Now investigation, what we do for leukemia, full blood count. That is, we find normocytic normochromic anemia with low WBC and platelet, bi and pancytopenia. Peripheral blood film, we find the blast cells. Bone marrow biopsy, we find blast cell more than 30%. Number puncture for CNS involvement. ABG and electrolyte we do for tumor lysis syndrome, which occur in a bulky tumor either before starting treatment of chemotherapy or after starting. So during chemotherapy, then there is electrolyte imbalance occur. There is hyperphosphatemia, hyperkalemia, hypocalcemia, and hyperuricemia. These are coagulation screening we do as there is bleeding, acute leukemia have DIC, disseminated intravascular coagulations. Then immunohistochemistry and phenotyping for Philadelphia chromosomes, then genetic testing, PCR, and the radiology, abdominal ultrasound, chest X-ray for lymphadenopathy. Now, how can we manage? For management purpose, we involve the multidisciplinary team, first pediatrician, hematologist, oncologist, lies with the school, psychological support to the family. Then we are going radiology departments. Then what is the treatment? Regular blood transfusions. We give antibiotics. We give the chemotherapy. Then radiotherapy we needed if it is spread to the nervous systems or brain. Then stem cell and bone marrow transplantations. Now, what about the poor prognostic factors of leukemia? That is, first of all, age is less than 1 year or more than 10 years. Male and African ethnicity. Tumor cell count before starting treatment with more than 15 to 20 to the power 9 per liter. Then Philadelphia chromosomes, CNS involvement, hypodiploidy, less than 44 chromosomes, persistent of leukemic cells, blast in the bone marrow 4 weeks after induction therapy. So this is all about leukemia. Video stations, it also comes on history. Thank you.